keep joining. I can see we have about 35 participants already. Welcome, welcome, welcome. So in exactly 2 minutes, we'll be starting the session. Thank you. Okay. Yeah. So just a few seconds and we'll be starting. By my time here, it's 1:59. So, all right. So welcome everyone. Good afternoon, good evening, good morning, wherever you're joining from. My name is Dr. Tumsia Maimunaman Isa, and I will be facilitating the session for today alongside Dr. Femi Kayode, who will be anchoring the participatory session. So thank you so much. I want to welcome each and every one of you. It's an honor to have you. But before then, I'll recognize our hub experts here with us, Dr. Olatunji Nasser, Dr. Kule Abiade, Dr. Gani Enahuro. I hope I got the name right. Our case presenter, Dr. Edith Esevo. Thank you all so much. And every other person, I'll keep recognizing as you keep joining. Thank you so much. So quickly, I'll take you through the agenda for the day. Stick to the allotted time to each item on the agenda. So it's going to be introductions by me for 5 minutes, and then a brief about Farmalert, 2 minutes, a brief about Project Tekla. Then we're going to have a pre-quiz, which is going to be, just I think 5 minutes, the participants to just answer the questions. Is just to help us measure the knowledge gained before presentation and after presentation. Then we're going to have the didactic presentation by Professor Edith Esevo, and then an open discussion, which is in 50 minutes, and then we'll have our expert recommendation so that we all go home. If not on the same page, but slightly on the same page, but would love that we all go back home on the same page on parvoviral enteritis. And then we're going to have a session and then announcements and then the next steps. So thank you so much. So I'll be taking you through the introduction. So basically, this is a teleeducation medicine series. We're partnering with, hosted by Farmalert, but we're partnering with, it's called Project Tekla, which is an acronym for teleeducation for clinicians and leaders in Africa for animal health professionals. So the Tekla partners are, we have MDoc, More Health, and of course, Ashoka Africa. So these are the 4 pillars that hold the ECHO model, basically using video conference technology to leverage scarce healthcare resources. We have specialists sharing best practices with colleagues. We have case-based learning, and of course, continuous monitoring of the program's outcome. And please take note, Project Tekla Africa leverages the ECHO model We collect registration, participation, questions and answers, chat comments, and poll responses for our programs. Your individual data will be kept confidential and handled by authorized personnel. This data may be used for reports, maps, communications, surveys, quality assurance, evaluation, research, and also to inform new initiatives. This session will be recorded and we'll be sharing a PDF version of the slides after the session via the email you registered with. So these are a few participation tips to help you maximize the entire session. Please have your camera on. We'd love to see your beautiful faces, of course. And then the facilitator will unmute you when there is need for you to speak. And then please use the mic and also kindly maximize the chat function for your questions, for your comments. We have somebody specially designated to extract your questions and your comments. So please use it to enjoy the session. So I'm going to invite Dr. Femi Kayode, who is the founder, CEO of Farmalert, to give us a brief about Farmalert. Sir,
all right, thank you so much, Dr. Tumsia, for a good job that you're doing for us in Farmalert. Dr. Tumsia is our community engagement manager for Farmalert. All right, so
thank you.
There's a loophole in the animal health sector in Africa. And one of the key things we intend to do in Farmalert is to see how we can, with what we do, bridge these loopholes or this vulnerability that we see. And one of those big gaps is that there's a difference between what we're taught in school. It's are carefully selected to handle most of this gap, bringing in well-read, experienced hub expert to help us give perspective to what we know, with the ultimate goal of improving the practice and improving us as individuals, and then, of course, us as a community of animal health professionals. The session has been carefully designed to ensure that you get the maximum benefit from what we're offering today. And from me and the entire team of Farmalert, I wish us a very happy time learning from each other. Over to you, Dr. Tumsia.
All right, thank you, Dr. B. So we can all maximize time allotted to each item. From our partners at MDoc, for another 2 minutes, quickly. MDoc, 2 minutes, quickly. Okay. Okay, so before then, we're supposed to have a pre-quiz, but before the pre-quiz comes up, I would love to help hub experts. So we have Professor Omobo Wale, who is the consultant veterinary teaching hospital, Faculty of Veterinary Medicine, University of Ibadan. Welcome, sir. We have Dr. Kule Abiade, who is the CEO, Pet Care Animal Hospital, Lagos. We have Dr. Gani Enahuro, who is the CEO, Ganro Vet Wari, who was also the former Chancellor for Africa World Veterinary Association. And then we have Dr. Tunji Nasser, CEO, Truth Miles Animal, and is presently the president of the Commonwealth Veterinary Association. So trust me, with this caliber of people on this session, we're all going to go back home loaded with valuable information on parvoviral enteritis, modern diagnosis and management therapies. So thank you so much. So quickly, we're going to take our pre-quiz. Please, I implore everyone to engage in the pre-quiz. It's just 5 questions answered based on anonymity. It's not going to pop up anybody's name. It's not a rival. Nobody's going to hang anybody or hold anybody for scoring less, or so that it's just for us to measure knowledge gained before the presentation and after the presentation. So please, can I have the pre-quiz up, please, participants? Let us all try to answer. So can I have the polls up? Yes, it's up. So we have 3 minutes for the pre-quiz. All right. Can we start attempting? You're going to see. Okay. 25, 26 seconds gone. Okay, we have some people. Okay, 2% of the participants. Keep going, keep going. As I said, it's just for us to measure knowledge gained, knowledge shared and knowledge gained. So please do answer the questions. Thank you very much. Wow, wow. Okay. This is amazing. It's going beautifully well. This is going well. We have 31% of the participants. Keep answering. Keep your answers coming. It's going to be an interactive session, that I know. Undoubtedly, with this group of experts in the room, we're going to maximize the session and make sure everybody goes home loaded with information, valuable information. We have 44%. We're about 2 minutes, 1 minute, 30 seconds gone. We still have about a minute to go. Keep your answers coming. Keep your answers coming. We have about 52%. That is good, but you can still do better. Yes. Keep your answers coming. This is really interesting. We have more people joining. Welcome. You can quickly take the pre-quiz. As I stated earlier, it's just for us to measure the knowledge shared today, and to be able to say, okay, I think we're going to have a post-quiz session after the presentation. That will help us measure the level of knowledge gained. So we have just a few seconds to go. We have 61% of the participants. Okay, we can do better. Keep it coming, keep your answers coming, keep your answers coming. 64%, this is impressive. I want us to, I know 100% is impossible, but we can do better than 64%. Yeah. Keep it coming. Okay. So I'm going to have a countdown. We have 2 minutes, 48 seconds. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And that's it. We had about 69% of the participants answer. That's really good. So can we move to the next agenda? 3 minutes gone. Okay, beautiful, 69%. That's not bad, it's just 5 questions. So, okay, so we're going to have our didactic presentation on parvovirus enteritis in dogs by Professor Tayo Omobowale, who is a consultant at the Veterinary Teaching Hospital, Faculty of Veterinary Medicine, University of Ibadan. You're welcome, sir. Thank you so much. The floor is yours for 15 minutes.
Thank you very much.
Thank you, sir.
Kindly permit me to share my screen.
So I think the IT support can do that.
Yeah, the IT support will share the screen for you, sir.
You can just continue.
Okay, I'm already sharing it.
Okay.
So IT support, so that we can just maintain a single file of screen.
Should I go on?
Okay, I think he can start with his own.
Well, you need to stop sharing your screen.
Okay.
You need to stop sharing.
Okay, let me stop
Yes.
sharing my screen. Stop share. Okay.
So IT support.
I've stopped sharing my screen.
Yeah, that support to bring up the codec immediately.
All right, so if we're having issues with that, just go ahead, share your screen and
Share your screen.
Okay.
Okay, no. So
Okay.
I think it's up.
Okay.
Okay, it's up. Good. So,
Next slide. Next slide. All right, good.
Okay, good afternoon, everybody. I have 15 minutes to present this slides. I want to thank the organizers of this program for inviting me. Can we go to the next slide, please? Next slide. So I'll be talking on canine parvoviral enteritis, focusing on the disease itself, the prevention, the control, the treatment options, and stuff like that. The canine parvovirus is a DNA virus. It emerged 4 years ago, and it continues to be a major concern for veterinarians all over the world. And the reason being that it's highly contagious and is a significant cause of morbidity and mortality. And because of the variants, the variations that have been discovered from the virus now is known to infect cats. It infects cats. Okay, can we have the next slide? Next slide, please. Next slide. Okay, I think I'll just go on. Currently, three subtypes of the virus are known to be in circulation. From the initial virus that came up in 1978, there was a mutation that led to the CPV2A in 1980. Then in 1984, there was another one, CPV2B. And in 2000, that's about 22 years ago, another variant was discovered, which is CPV2C. Various regions of the world are known to have predominance of one or more of these traits. Recently, a number of scientists and veterinarians in Nigeria took interest in the parvovirus. And what we have discovered up to date is that all the three variants are now in existence in Nigeria. And that has a significant impact on our ability to control the disease. Can we have the next slide, please? So the virus is a DNA virus. It is very hardy and it mutates easily. Another very bad thing about the virus is that it is not affected by most disinfectants. But the good thing is that the common household bleach, which is very cheap compared to other disinfectants and very, very common, is very effective in destroying the virus. So one very important thing we need to know is that over a period of 44 years, the virus has mutated about 3 times. And that's a very serious one. Nobody can tell if there will be another mutation in the next couple of years. Okay, next slide. Transmission is fecal-oral. Fecal-nasal transmission has also been discovered. And also, we discovered, some years ago that there is a higher incidence during the dry months of the year. Although, let me quickly chip this in, that appears to be changing. In the past 10, 15 years, we normally expect a high incidence of cases from December during the dry season, and this drops once the rains begin. But one observation we have this year is that, can we have the next slide as I'm speaking? Next slide. So one observation we have this year is that during the dry season, well, I'm talking of Ibadan. I don't know of what probably happened, what has been happening in other parts of Nigeria. So what we observed this year is that during the dry months, starting from late November till March, we did not have as high number of cases as we used to record before. Now that the rains have started, it seems as if we are having a higher number of cases being reported. So the figure we have here shows what we used to experience in Ibadan. We have higher number of cases when the rains are low. And when the rains begin to increase from like April, May, then the number of cases begin to reduce. And it is usually very, very overwhelming for vets. Sometimes you just have to make use of any available space. You can see the picture here. This was at the Vet Teaching Hospital, University of Ibadan. After we used up all available resources to manage cases, we had to start attaching infusion to pillars and everything. Sometimes we have as many as 25 dogs at once. You can see that is very overwhelming. And you can see that my vet in that picture was not looking so happy because he had been so overwhelmed with cases. Next slide. Clinical findings in the disease. You have an infection of the GI tract. This is what many people are familiar with. You can have the virus infecting the bone marrow, the myocardium, and also the skin and nervous. The nervous system can also be infected, although you rarely see such. Next slide, please. So these are some of the typical things we see: hemorrhagic, diarrhea, and that is what many clients see, many vets see, and that's what they complain about. The picture we have here, the heart shown here is from a dog that had myocarditis from parvovirus infection. Although the dog had enteritis as a presentation, but it also had myocarditis. And this was the ECG we recorded from this dog showing supraventricular tachycardia. Next slide. Okay. Diagnosis can be based on clinical signs on clinical pathologic abnormalities. You can also use diagnostic imaging and also detection of viral antigen in feces. The clinical signs are not specific because it can be confused with other causes of hemorrhagic enteritis. But given the epidemiology of the disease, around this time, when you see a dog showing GI signs, vomiting, diarrhea, then you begin to suspect that the case is a case of Parvovirus enteritis. Although there have been cases in which when you test, you see that although the animal is showing the signs, but the animal is not showing any signs. I mean, the animal does not have Parvovirus detectable. Next slide, please. Okay, so the GI signs like enteritis, lethargy, weakness, depression, foul-smelling diarrhea, vomiting, dehydration. Also, there can be fever. Now, so many people want to base a confirmatory diagnosis on the presence of foul-smelling diarrhea. This is not right, because there are several times that dogs with parvoviral enteritis will not have foul-smelling diarrhea. In fact, sometimes dogs are presented to you, they already have the disease, but they don't have diarrhea yet. Sometimes the clients will just complain of vomiting. You take a fecal sample, fine, you could see dark feces, which is an evidence of bleeding in the upper GIT, but at that point, you may not see diarrhea, but the disease is already manifesting. So as a veterinarian, when you see this, make sure you go further to confirm the test. Because if you release such an animal, and after 2 days, the animal now starts showing the diarrhea, the client is going to blame you. We have seen a lot of that happening. So because of the gastrointestinal hypermotility that can occur in parvoviral enteritis, intussusception is another clinical manifestation, clinical complication that can be seen. And this complicates the case very badly. So clinicians don't just, as clinicians, we shouldn't just start working on management of the condition with antibiotics, replacement of fluids and electrolytes. We should also check for possible complications that the animal may have. I don't want to spend too much time on this slide. Can we have the next slide, please? Next slide, thank you. So diagnosis can be based on, can also be based on diagnostic imaging, abdominal radiography or ultrasonography, although will detect non-specific changes, but it will give you an idea what is happening in the animal. Then you can also see if there is a presence of, you can confirm if there is intussusception in the animal, and that would inform the kind of prognosis you are going to give to the client and the kind of management you're going to give. In the last couple of years, we now have a lot of lateral flow antigen diagnostic kits available. These help a lot. But I've also discovered that there are some of these products that are not as sensitive as some other ones. If you have been using these kits and you have been able to identify any good product, kindly stick to it. we've worked with products that are not so sensitive, and we have worked with some other ones that are very, very sensitive. We are not going to be advertising products on this program. Next slide, please. Now, for the treatment, the mainstay of treatment is fluid therapy. The treatment is majorly supportive and symptomatic. It can be very expensive, it can be time-consuming, it can be laborious. But as veterinarians, we have to give everything to ensure that we save our patients that have been presented with parvovirus infection, parvoviral enteritis. So fluid therapy is very, very important. Fluids like lactated ringers, very, very important. Darrow solution, also very good. Then antibiotic treatment, sometimes you may have to combine like 2 or 3 antibiotics. You may have to combine like 2 or 3 because, you know, the aim is not to attack the virus, but to take care of any secondary complication. So sometimes 2 or 3 antiemetic treatments to stop vomiting. There are so many drugs that you can use. Nutritional support, that is another thing. Before, years ago, when I was a vet medical student, what we were taught was whenever you have an animal vomiting, do not feed. But recent studies have shown that when dogs are presented with canine parvoviral enteritis, you should try and feed. Try and feed, give some food. That would help the healing of the intestine. Research findings have shown that when you feed, it will help the healing of the GIT. Now, somebody wants to ask me a question, what if the animal vomits? Fine, we know that when you feed an animal that is vomiting, it can trigger further vomiting. If the animal vomits, go and make sure you give more of your fluid to correct whatever loss the animal might have had. Another one is blood transfusion. Sometimes the hemorrhage is so severe that there is no way you can save the animal if you do not do blood transfusion. You know, blood transfusion, transfusion therapy is another area of clinical management that we cannot start talking about here. But transfusion therapy is very, very, very important, especially in animals that have very, very severe hemorrhagic episodes as a result of the disease. Now, there are other things you may consider. If you can get hyperimmune serum or serum from an animal that has just recovered from the disease, that will help neutralize the virus, and it will help shorten the course of the disease. Another thing is that given the GI involvement, which is the usually encountered clinical presentation, you may need to give analgesics to control, to counteract the pain, the GI pain that the animal may be having. Next slide. Like we all know, this disease is vaccine preventable, and vaccination is a very good, vaccination is a very good way of preventing the disease. Good health care. Make sure your dog does not have any co-infection, anything that will reduce the immunity. Make sure the dogs are on very good diet. Now, disinfection. There's something about the virus. The virus can stay in the environment for up to a year is a very hardy virus, very hardy virus. And what that means is that if the virus is in your environment and you do not disinfect, that virus can still infect other dogs several months after. In fact, up to a year and even more. So this is very important. Next slide. But despite the fact that vaccination can prevent the disease, several times there is vaccine failure. And you can imagine how embarrassing it would be. You vaccinated a dog and the client comes back some months later that the dog is vomiting and stooling. So what do you say? What do you tell the client? Would you tell the client that the vaccine you gave was fake or what? There are so many things that we believe are contributory to the vaccine failure, which we appear to be seeing now.
Professor Omogwale, sorry for interrupting, yes, but you've actually exhausted the 15 minutes, so I'm just going to give you maybe another 5 minutes to quickly run through the end of it. It's really been interesting, but we still need to stick to time.
Yeah.
Thank you, sir.
I'll finish it in 3 minutes. 3 minutes.
I'll hold you to that.
So, yeah. So, possible causes of vaccine failure, which we vets must understand, are this role of the canine parvovirus variants, poor quality vaccines. There are so many things in the market now, and they are just poor handling of good quality vaccines, handling of vaccines by unqualified personnel, improper vaccination procedures, host factors, and microbes. When we talk of the role of CPV variants, so many vaccines in the market contain the initial type, and there are some vaccines that contain just the type 2A, type 2B, type 2C. From our own studies, we've not come across any vaccine that contains all the three. And there is a great concern that these antigenic differences can affect the ability of our dogs to mount up an effective immune response. So in this case, there is little we can do. Like I told you earlier on, in Nigeria, we have all the three variants. And I don't know of any vaccine in Nigeria that has all the three variants. So that is one. Another one is poor quality vaccines. We need the regulatory authorities to help us in this, because there's really nothing we can do. We have seen vaccines that when you administer them, the next day your dogs are coming down with enteritis. Poor handling of vaccines, we know about this. Sales of vaccines to non-vets, many of us are guilty of this. Breaking the cold chain, improper storage. Some people freeze rather than storing at 4 degrees. Another one is improper vaccination procedures. Some people will present a dog to you at 8 weeks, and at 8 weeks, the dog has received all the shots of DHLPP. How possible? They start at 1 week, they give at 3 weeks, they give at 6 weeks, when the maternal antibodies are still very, very active. Host factors can also be responsible. You can have poor responders or non-responders. Of these, you have the Rottweilers and Dobermans, very, very highly represented. Then animals that have other morbidities, sick ones, helminthosis, immunosuppressed and everything, can succumb easily, or the vaccine that is administered will not work at all. Okay, I've talked about microbial mutation of the virus itself. So finally, this slide summarizes the causes of, okay, I don't have that slide here, but now you are aware of the causes of vaccine failure, and you have to be very, very careful, as we have to be very careful as veterinarians, ask questions to know exactly what we could be dealing with. Are we having non-responders? Is there any problem with storage? Is there poor vaccination, improper vaccination, and so on? So my time is up. Thank you very much.
Yes, yeah.
Yeah.
Thank you so much, Professor Omobowale. That was really insightful and informative. I, for one, picked, I wouldn't say one or two things, I picked a lot, literally a bag of information from your presentation. Thank you so much, sir. So quickly, I will be bringing up Dr. Edith Esevo to present a case she handled of parvoviral enteritis. Dr. Edith Esevo, you have 5 minutes to wow us with your presentation. Thank you. Dr. Edith. Dr. Edith Monica Esevo. Okay. She's coming on shortly. Sorry, she'll be coming up shortly. We have about 200 participants in this room. That's good. I think this is the third session, but the second session for veterinarians. Okay, Dr. Edith Monica Esevo, the floor is yours. You have 5 minutes. Thank you.
Thank you. Thank you very much for the opportunity to share a case I handled in the midst of my bosses and senior colleagues. I appreciate, I do not take this for granted. Okay, so since I have just 5 minutes, I would just go ahead and present the case. This is a case of parvoviral enteritis in a 4-month-old Rottweiler female puppy weighing 12 kg. On presentation, the history and signalement I was able to pick up where the complaint from the client was that the puppy was off feed for about 2 days and was vomiting. The vomition started a day, then the diarrhea started a day after, but the diarrhea just had a tinge of blood, was not bloody. And from the history, I was able to pick that the puppy was vaccinated 3 times by an expert. He didn't disclose the name of the person, either a vet or not. The puppy was fed on canned food and skibbles. The puppy is housed in a manually constructed wooden cage and is the only dog present in the house. He disclosed that about a month ago, he had dewormed the dog using half tablets, the Canine tablets. Next slide, please. Upon physical examination, the temperature was 38.3. The pulse rate was 100 beats per minute. Respiratory rate was 20 cycles per minute. The mucous membrane was normal. By assessment of the level of dehydration, I arrived at 6% dehydration. The body condition score of the puppy was good. There was arcing of the back and there was pain on palpation of the abdomen. Next slide, please. Okay, so from my records, my history and assessment of the dog, the puppy, I came up with 3 differential diagnoses: helminthosis, food poisoning, parvoviral enteritis. I consider helminthosis because he was actually not following the right regimen for deworming. I consider food poisoning because aside the vaccination, he doesn't have the vet visits I don't know how he cleans the dog plates, the puppy plates, that's the feeding trough. And I also considered parvovirus enteritis because I couldn't ascertain the vaccine given and if it was given by an expert. So my plan of action was to collect fecal sample for endoparasite screening, to collect fecal sample also for canine parvovirus antigen test, that's lateral flow immunochromatography assay, and to manage the case accordingly. After the test, parvoviral enteritis was confirmed, so management commenced. For my management protocol, I placed the puppy off feed and water in the course of management. I calculated the fluid loss, maintenance volume, and so I placed the puppy on infusion lactated ringer solution, 5% dextrose solution, and also in metronidazole infusion. The antibiotics used were gentamicin, amoxicillin. I used vitamin B complex and also an antiemetic metoclopramide. Because the dehydration was mild and the dog was not too dull, based on my assessment, the dog didn't warrant, the puppy, sorry, didn't warrant a 24-hour period. So I was dripping and replacing lost fluid morning, evening. On day 2 of treatment, the diarrhea turned bloody. The vomition continued. So I incorporated vitamin C injectable into my management protocol. Every other medication was same. On day 3, there was still bloody diarrhea, there was still vomition. My medications continued as the first day. On the 4th day of management, the puppy was active, it was wagging the tail, the vomiting had stopped, but the diarrhea persisted. There was no traces of blood in the diarrhea though. So my medications continued as the first day. On the 5th day of management, the puppy was active, that stopped vomiting and passing out diarrhea. I started attempting water and bland diets. But on the 6th day was when I went full into giving water and giving bland diets. On the 5th day, I had to recalculate the fluid because there was no longer ongoing losses or deficits that I had to replace. On the 7th day, I had to deworm the dog, that's the puppy, using Canine. The puppy had resumed eating and was discharged. Next slide, please. Okay, so I had to advise the client to bath the puppy just to wash off and reduce as much as possible the virus that may be on the body, to wash and disinfect the puppy's cage, common household bleach, to keep the puppy away from other dogs to prevent infecting others, because the puppy, even though recovered, can still infect others for as long as 14 days after recovery. I advised him to always ensure presentation of cases, because there are lots of clients that wait until after like 3-4 days when the animals stop eating before they bring the puppy or their dogs to the clinic. I advised him to present the puppy for a booster shot of vaccine, just to be sure what vaccine and also the immune response of the puppy. I advised him to vaccinate against rabies because as at 4 months old, wasn't aware of rabies, and also to seek professional help, not just go around to the person he bought the dog from or dog breeders around. Thank you for the opportunity. Here are my references.
Okay, Dr. Edith Monica Isavo, thank you so much for your beautiful presentation. You know, listening to you, not exactly what I could hear Prof. King, you know, and so thank you so much for coming on board to share your beautiful experience. So we're just going to open the floor for a discussion, which is what the ECHO model is all about. A bidirectional flow of information between the participants and the hub expert and everybody else in the room. So Dr. Femi Kayode, you're up for the next 50 minutes. We'll be having a discussion. Keep your questions coming, keep your comments coming. We have somebody extracting them, and Dr. Femi is going to direct them to the hub experts in the room. Thank you so much. Dr. Femi, the floor is yours.
Thank you so much, Dr. Tumsia. I'm happy to do this.
Yeah, thank you.
Thank
you too.
Just to reiterate, this is the highest we've gotten so far as an attendant in our ECHO session. This is a third, but also to acknowledge the fact that this is a hot and burning topic for every one of us. But we have taken the time to assemble very good people who have been managing this case, people who are authority in this case, and then to advise us. So the first thing I want to do, I've seen people raising their hands. You can equally use the chat bot. Somebody is in charge to pick up all your questions and then ensure that they bring it to my attention. We have just barely 50 minutes. I will attempt to ensure that everybody have a space to say something, at least the best I can. But before we go into the interaction, I want to call the hub experts. So I will go with Dr. Tunji Nasiri first, then I will call Dr. Kunle Abiade, and then Dr. Gani to just give us 2 minutes each. What they think about the Parvovirus that we are discussing today and what we are ultimately getting wrong. Because so far, 15 years after graduation, it seems as if the Parvo case keeps increasing year by year. And I also know that the number of vet doctors out there keep increasing year by year. Something is wrong, something is not right. So what do they think generally? And then what is really the issue with us managing parvovirus? I think I will go with Dr. Tunji Nasir first, who is the CEO of Truth Miles and also the president of Commonwealth Veterinary Association. Go ahead, Dr. Tunji Nasir, 2 minutes.
Yeah, thank you, Dr. Femi Kayode, for the opportunity. I really want to say a few things because Parvo is not something that we can discuss, like Dr. Enawolo suggested during the pre-test of this exercise, that we can discuss in just an episode like this. Because, for example, if I want to comment on what Dr. Esivo said, I would have wanted some what I call pearls of management that a lot of us are not actually taking cognizance of, and people are asking that why do we lose Parvo dogs and all that? And because of this, I would want to say that when you are presented with a Parvo case, for example, there are certain things that are indicators that will let you know whether you are going to succeed with that case or you are not going to succeed with that case. And my own practice is I do the following because it is how we handle it that I'm going to be saying now. I monitor the WBC count because I know that the correlation to survival sometimes depends on if you're able to monitor the WBC count because we have a lot of lymphocytes. You see a reduction in lymphocytes and there'll be a general leukopenia. If I do it the first day and the second day or perhaps the third day and I see that it is decreasing and it's not increasing, the chances of that dog surviving is very slim. There's also hypokalemia. Potassium is always being lost in Parvo. if you are not replacing potassium, you have very high chances of losing that puppy. Don't even talk about it, because you know the loss of potassium. The loss of potassium, it causes muscle weakness, not only skeletal muscle weakness, also cardiac muscle weakness, and the dog can have cardiac arrest and all that. So that is very, very important to monitor during your treatment. Monitor the potassium issues. Then again, you want to start early alimentation. It is very, very important. I don't care whether it's vomiting. So that is why I'm going to advocate that a lot of vets should know how to place nasogastric tubes. Nasogastric tube. You must know it. If you are telling me you are treating parvo and you don't know how to place nasogastric tube, then I'm not going to say you are doing the right thing, because early alimentation has been found to be very, very proficient in making sure that puppies survive during management. But for your direct question, what are we doing right? What are we doing wrong? Those three things are very, very important, but we still have a lot. Professor Mobowale said is a vaccine preventable disease, very much so. But there are lots of discussions about these vaccines, about how we vaccinate, vaccines and vaccination. Maybe when I have a bit of a time or a question that is related to vaccination, I will be able to give you my insight and the new development as approved by the World Small Animal Veterinary Association as guidelines for vaccination and the events.
All right, thank you, Dr. Tunji. Nasser, I'm still coming back to you, right? Because I've been to your hospital and I know that just very few of us have that standard, right? The average vet that might be listening just has a table and a drip stand. And you've said we need to measure potassium, measure whatever it is we need to measure to keep the animal balanced. So I'm going to be coming back to you on that to see how we can bridge the gap between the average vet out there that has a table and a drip stand and a couple of bottled drugs, and you that have all the certification. So let me call on Dr. Abiadi. What's your general view about this? And then exactly what are we doing wrong? I'm glad she said the dog survived. I can't count the number of dogs I've witnessed die because of parvoviral enteritis. What's your general view, Dr. Kunle Abiadi, and what are we doing wrong? So can we get Dr. Kunle Abiadi unmute himself, and then please take up the stage.
Okay, thank you, Dr. Kayode, for that question. And I want to thank Professor Mobowale for the opening presentation. I think it covered a lot of areas. What are we doing wrong? Seriously, we're doing a lot of things wrong. Tunji has mentioned some of them from the area of management, but I want to look at from the area of prevention. You know, a breeder buys a dog, and they are all interested in the puppies. They will not bother about good feeding. Even when the bitch is pregnant, they are not bothered. All they're looking for. So during the pregnancy, the bitch was not properly fed on good plane of nutrition. The nutrition is bad. You now have puppies that are not of good quality nutritionally. One of the other things that is being done all over the world that we're not looking at is supplementation of colostrum. We now have artificial colostrum rich in immunoglobulins, which can be done from the day one. Give all the vaccination, give everything. If the maternal immunity and stability has been compromised, even the vaccine will not pick. The vaccine is not a drug. It's supposed to act and elicit antibodies. So you must properly manage the puppy from day one. One, feed the bitch very well. Two, ensure that it's a new thing that I'm encouraging people. And even in Nigeria, we have companies that are selling colostrum that are rich in immunoglobulins. So let us advise our clients. When we do some of these things, you now have, so by the time you're about to vaccinate, the vaccine you are giving will pick and will be able to elicit good immunoglobulins, antibodies. So it's very, but some of those things we don't do. We are all after money. The second, so fortification of good nutrition is important. The second thing is about the biosecurity. We'll be having a lot of, somebody bought some puppies, they died. 2 months after, bought another set, they died. The biosecurity has been mentioned. We need to do that. The other thing that we're doing wrong is that some of us, you have said it, a vet is having 1 room or 2 rooms, and he wants to be treating parvo. We have seen that some of the virus were picked from some of the practices. So if you must treat parvo in your place, then make sure that you have a totally designed place and you have a vet that is allocated to that room, and there is no connection between the sick dogs and the healthy dogs that are being brought in. So that's some of the things we're doing wrong, because it is sometimes also puppies are presented at the first time for vaccination. In our practice, we don't ever vaccinate on the first presentation. We don't. When you present to us, we look at it, we'll either the worm first, boost the immunity, and give you another date for vaccination. And one other thing that we are doing wrong is that every vet should be able to have this, the testing kits. They are very, very important. In our practice, the moment you present a puppy, we must screen. If you don't pass, you don't enter our facility. And with that, we're able to show that we don't introduce parvovirus into our own facility. So when you test and it's negative, then you can go ahead. Even before we vaccinate, we boost the immunity with a lot of boosting supplements. So we can give you a week, and after a week, you can come for the vaccine. Somebody brought a puppy to us and said we should vaccinate. We said, as a rule, we don't vaccinate. But because of money and everything, people will do that. The man was so angry, removed the dog from us, took it to another vet. The vet vaccinated that same day. What happened? The dog came down with parvo. Then the man now bought another one and brought to us. We said the same thing. He said, yes. He said, I now understand the reason why you didn't do it. He said, that other one died. You people were right. Let us as vets do the right thing. You know, there are standards. There are standards we must abide with. The moment we go against those standards, then we are causing problems. So, well, the breeders are doing wrong. The pet owners are doing wrong. We vets were doing wrong. Time has come for us to do the right things. Thank you.
Thank you so much, Dr. Kunle Abiadi. You know, sometimes listening to you can be very scary. And I hope my doctors are listening. You know, to have someone bring 6 puppies to you at the same time and ask you to vaccinate all 6. In your mind, what you're calculating is the revenue. Then to now have the courage to tell the client to go back with those 6 puppies, and you think the client will come back, it's a tough call. But again, we are listening. There are logics to this. For you to be this successful, it means there are habits you've adopted. And then I hope the people who work with us are also listening. So now to Dr. Gani, but I'm still coming back to you, Dr. Kunle, to know exactly why you don't treat parvo. I know you've mentioned a few things around that. I got a reliable information that you don't treat parvo in your practice. Well, That's also another tough call, but we'll come back to that. Dr. Ganier Nahoro, what do you think?
Well, let me thank you very much, Femi. Let me thank you, Farmalert, and the lead presenter and Dr. Edith for brilliant presentation. Let me also beg Kunle to cool temper a little because I can see that because we're actually paying a lot of things around Parvo could be very provoking on our side and also on the side of the clients. And let me quickly warn here that very good history taking is key in managing Parvo. A lot of our clients don't tell the truth. And don't let us accept what they claim to be their history or the face values of it. Let us have, what I do in my clinic is to have a checklist and cross-check whatever they say with the good observation that the veterinary eye has given to us. If they tell you that the dog started vomiting just yesterday, why don't you just begin to add +2, +3 days to that? And if they said they just saw the diarrhea today, it's possible the diarrhea had started 3 days before. So history taking is very important. And like Kunle said, we must begin to adopt the principle of referrals amongst ourselves. If you don't have the capacity for intensive care management, don't touch Parvo because it's going to embarrass you. You're going to possibly lose the dog. And then the client will ask for, will be looking for how to get some refunds of the money he would have thought he paid. So we must encourage the principle of referrals amongst ourselves to facilities where there can be boarding, hospitalization, and intensive management. And in those facilities, there must be isolation pens. We have isolation pen in our place, and then we must keep such dogs, such puppies away from contaminating your clinic and also cross-infecting other dogs or puppies that are coming into your practice. So we need to be very mindful of how to develop our checklist. Then finally, before we allow, for the 2 minutes I have, we also, as veterinarians, please go back and read up a little bit about our clinical pathology notes. Perhaps because of my biases towards clinical pathology, we must be able to interpret the laboratory reports. I observed that a lot of our vets, our colleagues, will just look at the laboratory reports and just think it's okay. We must be able to know exactly what a left shift in WC count, what it means. Because with the left shift alone, is which some laboratories can generate for us, you'll be able to know the status of the animal in compromising itself. Because if there is a left shift in the WC count, it will tell you that the bone marrows are already getting engaged in pushing out into blood circulation in mature cells. And that tells you that the mature cells have done their work, and then the dog is already fighting hard to survive. So we need to look at our notes and try to be capable to interpret, even our ultrasound scanning when they bring them to us, we should try to be able to interpret them. And I say particularly the basic blood profile interpretations. We must be on top of all that. I think I will stop here if I have to stay with
Thank you so much, Dr. Ganier Nahoro. I'm still going to come back to you, sir, to help us tackle, because there are a lot of young vets. We have well over 200 participation. There's a lot of young vets with very little capital, and they barely just have one room as a practice. And in that one room, they divide that one room into two, have a pet mat, and behind, they have their office desks close to their treatment desks. How do you think that young vet, right, will balance the two? Should he stop parvovirus treatment, or as you have said, should he refer? I want you to ruminate this very huge insight. I see a lot of people, I see some hands raised up, I see questions. I'm just going to take a round of questions across our hub experts, and then I will start picking specific questions from the chat board and acknowledging people who are raising their hands. I see Dr. Charles Ibe. Thank you so much for being on this call. You will be acknowledged shortly. Professor Omobawale, you mentioned during your didactic presentation that some dogs at 8 weeks, they are done vaccinating them. Of course, that's wrong. I want you to clearly state again, at what age, from your professorial knowledge, should we vaccinate our dogs? We know we have a background from school, but I want clarity from you. You also mentioned something really very scary, and I want you to combine the two thoughts in one. So ideally, and that's what I know prior to this echo, maybe it could change, that when a dog is vomiting, you should stop feeding the dog because of the hypermotility of the intestines, right? You don't want to irritate the dog. I will still give the same advice, except you provide other reasons why you think we should feed a dog that is actively vomiting. Professor Mobawale, can you please quickly help us attend to these two questions?
Okay, thank you very much. Concerning the issue of vaccination, normally vaccination should start from 6 to 8 weeks. Early vaccination at 6 weeks for puppies born to mothers that were not vaccinated, okay? Then you, depending on the vaccine, if you read the vaccine label, sometimes they give you 2 to 4 week intervals before revaccination. The reason is because you cannot really tell when the maternal antibodies will wane off, and the maternal antibodies will not allow your vaccine. Everything we know from basic veterinary knowledge. So 6 to 8 weeks to start, then between 10 to 12 weeks, then 16 weeks for the last one. But recently, the World Small Animal Veterinary Association has recommended that between 6 months and 1 year, there should be another booster vaccination given. So that is the current protocol now, which is different from what many of us learned in school and what many of us practice. Then I think a lot of vets they start vaccinating much earlier than 6 weeks. It's not going to work. Then because of the fact that vaccines now have made their way to non-vets, they just inject, and they believe they have injected, they have given 3 or 4 shots. It can't work that way. Now, what was the second question? Okay,
so
concerning feeding, yeah. You know, what I said was corroborated by Dr. Nasir. When you feed, when you talk about early alimentation, it helps the healing of the GIT. It helps the healing of the GIT. A lot of research has been done on that. Although we know that there can be vomiting in some cases. Even sometimes when you don't feed, there'll still be vomiting. If you feed and there is vomiting, replace whatever you have calculated as the amount of fluid lost, okay? The main aim is that you want to get the animal back on its feet as quickly as possible. And that's the reason why it is recommended that early in the disease, you start feeding. You don't stop feeding at all.
All right, so quickly, I want you to just make a comment on this. You mentioned in your presentation that the vaccines that we have now, they don't contain all the strains of parvovirus that we have currently. I want you to establish that, because I saw a comment on our chat, somebody saying that their vaccine contains all the virus. Have you tested all the vaccines that we have?
Yeah, that's a very good one. You know, in Nigeria, every day you wake up, you see a new product in the market. But about 2-3 years ago, I had a PhD student on parvoviral enteritis, and we got a grant facilitated by Doctors Abiadi and Nasir to do the study. And apart from looking at the virus, we also looked at vaccines. We did not see any vaccine that contained all the 3 variants. Okay, but I can't tell, anything could have happened within the last 1 or 2 years. But from our study, no vaccine had all the 3 variants. And right now in Nigeria, from our study, from other studies, quite a number of Nigerian vets have worked on the parvovirus. So from our studies, all the variants are in Nigeria. But if we have a vaccine that has all the variants contained in it, that's a very good one. That's a very good one.
So my own biggest wish, and I'm also talking to myself, is that our regulatory body are stronger on this importation of these vaccines. Because some of these people are they are marketers.
Yeah.
In fact, they will tell you if you do 1 shot, in 5 years' time, your dog is not going to come down with parvovirus. But again, if we have a center that is testing these vaccines and telling us exactly what you're telling us, like you ran an experiment, no vaccine contained the 3 strains. So they will have like a little drawback in marketing to us what they are not sure of. I want to go back to Dr. Tunji Nasiru quickly, right? What are the simple confirmatory diagnosis activity we can go in for young vets that are listening? Because what we know is that once it's foul smelling, right, it's parvo. I don't want to ask Professor Omobowale the question because he said that the foul smelling smell we perceive when attending to a parvo case is almost always not should not be confirmatory. So from your experience, are there simple kits that you think every vet needs to have that can help us in our diagnosis of this very deadly virus? Dr. Tunji?
Yes, I think both Professor Omobowale and Dr. Edith mentioned the fact of the presence of these kits around. And they've been around for quite a while. These lateral flow kits, they're around. And Prof mentioned it very well. And I think for your interest in the young vets, I don't know whether those of us that are old in the practice, I don't know what, I don't know whether you have anything for us. Let me say it like that. But the thing is, the lateral flow kits are everywhere. I don't know. Yeah, they're everywhere. But I don't want to redirect your discussion, so to say, on this topic. And I'm sure that we're still going to get to this. But I think the emphasis of this engagement this afternoon should actually be on prevention of parvo, from our environment, because we can actually do it. And like I said, I don't want to redirect your train of thought, because I know maybe you're still coming there. But I think we should be talking more of how to prevent this parvo thing. So, like I said, the young vet has an ample of kits that he or she can buy from most of these vendors, and they're all everywhere. A lot of them from Korea, from China, from Israel, from the UK, from Europe. They're all around, But the problem is a lot of us do not want to invest in diagnostics. That is one thing we just have to take out of from as a take home from here. A lot of vets do not want to invest in diagnostics. Like when I was answering the other time I was talking about the issue of monitoring of your WBC count, and Dr. Enauro also said the same thing. Do we even collect blood to do a hematologic profile of the patient that we have? Because if we collect blood to do the hematologic profile, we will know the character of the WBC and everything. We'll know whether we have a high potassium level or whatever. We know whether we have a high glucose level or whatever, but we don't do it. So we just treat in isolation as Babalawo, and and that is the reason why I think when you say you want to treat parvo at any point in time, you must be ready. Don't be shy to tell the owners of this pet that you need to do diagnostics. You shouldn't be shy, because if you don't collect the right money to enable you to do serial monitoring of some of these parameters, there is no way you'll be predictive, of the outcome of the enterprise. So I want to tell all the vets, I'm not going to refer to only young vets, the medium vets, the old ones, and everybody. Try to know that you will be doing diagnostics and you must incorporate the price of diagnostics in your charge. I'm so sorry. I cannot treat Parvo for less than 200,000 as deposit. That is me. If you cannot pay it, you go. That is the thing. Yes, that is the truth. Honestly, that is the truth. If I want to pity you, you pay 150, and I'll tell you it's a deposit. Because I know we are going to be there 24 hours for about 3 or 4 days. I'm going to dedicate a doctor to do that. He's not going to go home for 4 days. So am I going to give him peanuts? No. And it's because of the serial monitoring, because I have to send to Dr. Biade all the time, okay, I need this blood, let me do this, let me do this, and that is the thing. So the young vet should be courageous enough to tell whoever is a client to say that I will do diagnostics. I will do 24 hours monitoring. I have to do this. I have to do that. It is important. Thank you.
Thank you so much, Dr. Tunji. Your last statement caught my attention, that you will not attend to Parvovirus case without a deposit of 200,000.
That's
what came to my mind is probably to build a specialist hospital for Parvovirus and treat 5 in 1 week and go to rest the rest of the day. That would be an interesting business model.
You'll be shocked that the gain on those 200, on that 200,000 naira is not even up to 50,000 naira. You'll be shocked.
Well, I will allow Dr. Gani talk about the economics of this Parvovirus, but let me get to Dr. Abiade quickly. Well, the interesting thing is you said clearly, Dr. Okunle, that you don't treat Parvovirus in your hospital.
Yeah.
So I want you to please talk around what are the biosecurity measures you advise us to keep. I think the interesting thing I heard you say is that you will first of all test any dog before you admitting them. A lot of us don't do that. Like, I've grown in a fairly small clinic setting, and we just admit those dogs. I want you to please emphasize on what you do and what you mean by the biosecurity measures, so that you also mentioned that clinic infects dogs sometimes if proper biosecurity measures are not taken. Please, can you just spend the next 2 minutes educating us on this?
Yeah, it is not that I don't treat Parvo. If in our practice we have 7 doctors. If you come with a Parvo case and you want us to treat it, we will move our clinic to your house, donate a doctor to you, and we'll be there for the next 6 days. And you know what you're going to pay. You're going to pay for the doctor that day, the assistant, and everything. But the only thing is that we don't do in our facility because we looked at it. It's just that most of the time we don't calculate the economics of our management, economics of what we do. If most of us do it, there are some things that are very, very successful. That's what the teacher said. If I get any Parvo case, I'm referring the Parvo case to you. He said, yes, refer. We can collaborate with that. I'm planning to have an infectious clinic where we can do all those things. But until I get it, I will not do it in my fast. It's a decision that I will take. And that decision, I will tell you a story. Many years ago, about maybe 10 years ago, we bought about 7 Rottweiler puppies from South Africa, beautiful ones. We're selling them for 400,000 naira. But one of our staff, and there was a Parvo case we were treating, one of our staff, carelessly went, there was managing, they went to those puppies, infected them, and we lost over 2 million. So what is the importance of, why will I lose money because I want to save one dog? I won't. That is why I concentrate on prevention. Most of my patients don't come down with Parvo. So when I hear that Parvo, I just laugh because we do the right things. Prevention. Let's concentrate on prevention. And when we prevent, we don't have the problem. Because for you to do what the basic things that we do is that we test. And once we identify that you have it, we discuss with you. You have one option. We treat it in your house. We tell you how much it will cost to send the doctor to your house. And they will be there in the morning. The doctor resumes. Or we send you to our referring hospital. In this case, I send them to Dr. to treatment, because treatments, they have a special place, which is different from the regular clinic that they use, and they can manage, and they can, the basket of the place is good. So I'm confident of that. Why do I need to waste my time treating Parvo and then infect my place when I know somebody else? The time has come for us to collaborate with ourselves. 2 or 3 of us can come together and say, yes, this is what we'll be doing. But this one room apartment, mushroom all over the place, will not help us. The time has gone for us to get things better and make more money. But this 1 bedroom, everybody's doing, and we're wasting our time. How much money are we making? We're making peanuts. Somebody bought a dog for 1,600,000 naira. And the dog comes out with Parvo and he's selling you, I cannot pay you 100,000 naira to treat it. I can only pay you 100,000 naira. And because some of us are so cheap, and then we want to do that, the cost of managing Parvo is so expensive. The biosecurity that the treatment you'll be doing, the fumigation and disinfection that you'll be doing to your own facility is huge. So that's why we don't do it, but we collaborate with my colleagues by sending what I think from the economics is not profitable to me. I don't bother about it. Let me spend my time in my diagnostics. Let me spend my time in doing better things. Everybody must look at those areas you are strong and then concentrate on that. You can't be a jack of all trades. You can't. Thank you.
Thank you so much, Dr. Abiade. I think what big lesson I learned from you coming to Lagos was the packaging or the courage of a vet, right? And I will also look forward to your suggestion on the infectious unit you want to create, because I'm not sure if that facility exists yet. We have that for humans. We don't have that for animals yet, and it would be a very good thing to have you pioneer that. We are running out of time, but we'll cover everything we need to cover. I want to go to Dr. Gani now. Then I will now pick the people's hand whose hands are up, the 4 people, to just share 1 minute each. Then I will now go through the chat and start picking the questions that are there so that we can go through what we need to go through. Dr. Gani now, Dr. Tunji said 200,000 or you go away with your pets. Some of us, with a few privilege, we know some people charge 15,000. Some people charge less than that. What will you think? How do you think, from your experience, we should approach the issue of charging or the finance part of managing a case of Parvovirus enteritis?
Yeah, thank you. Right. I think the general trend is that veterinarians are very shy when money is being discussed. I'm one of them. We are not very bold discussing bills, but we need to be careful because we must survive. The Parvovirus, you see, diagnosing it through the test kit is very important. But what is more important is the destructive effect of viruses. Remember that all microorganisms are like commensals, they don't want to kill the host. So it is the complications of what the viruses have done on the system that matters a lot, which requires that serious testing, serious laboratory investigation helps a lot in the management if it is going to be successful. We also have to be very bold in discussing our prognosis with our clients. Despite what you are going to ask them to pay, You can't have a final bill from me in my clinic or from Moss at Ganarovet when you come with a presentation on Parvo. You have to make a deposit payment that we consider to be reasonable, and that will be based on the number of testing we would have, because based on our observations, we would have known that we might need to go into the laboratory more than 5 times in 1 week or more than 10 times before we discharge your dog, if it's going to go home safe. And then we'll be able to tell also the client right from the beginning that in all cases that require intensive care, intensive management, the chances of survival is not up to 50%. In fact, we go very low to the client and prepare his mind for the worst, his or her mind for the worst. That is what many of us are not doing. And then we allow the client to have some good hopes as if we are an insurance company. We are not. So we need to be very mindful of all of those realities. So if a client comes in and is not willing to follow through with your propositions in terms of your deposit, I think you have to be very firm and careful there. It's not a research center. What we are talking about is management of a very serious situation for which money is significant. A client, a clinic that will go using his funds to run investigation for a client is already heading for the loss. So in looking at the severity of the case, we must also be very mindful of the economy of scale. We have to be sure that we are not going to have a client who could even, at the end of the day, be angry with you, maybe pretending to be very sorrowful at the loss of his pet, and just walk away. Then who bears the loss? So the eyes that cry, as they say, must also be seen. So when you have cases like Parvo, be mindful of what you may want to do and have and generate a bill that must cover your expenses, especially in hospitalization. Hospitalization is not just boarding. Where you put a dog in there, we have dogs who come to us for boarding, maybe with their owners on holidays. They need next to nothing other than feeding and washing and maintenance of their kennels. But when a dog is sick that requires intensive management, the cost and charges around hospitalization has to be carefully made available to the client and then presented to the client to pay. And that is why I agree with Tunji. Well, in Lagos, 20,000 is like what we could call 50,000 in other places, or even less than that in other places. So, but what is important is reasonable deposit must be paid, depending on your location. Reasonable deposit. Thank you very much.
Thank you so much, Dr. Ganyenaro. I'm tempted to ask us to run a poll that your last Parvovirus, people could just state, how much did you charge? I hope I will not see 5,000, 10,000, 20,000.
Location matters.
But it will be an interesting poll to watch. So if you have the courage to state how much you charge in your last Parvovirus treatment, just say it on the chat. So to the people raising their hands, I will just give you 1 minute each, straight to the point. Then I will start picking comments from the chat bot. The one that I think I already answered, I will not need to pick. The ones that I think are still important, I'm going to be stating them out. So let's start with Dr. Charles Ibe, an elder statesman. Thank you so much for joining this program. You can please unmute. Okay, we've unmuted you.
Yeah, thank you for this session. You can see how explosive it is in terms of participation. That takes it that it has a lot of ingredients. Let me word the young man who had just said that he has the 3 strengths. I hate people deceiving people. Please Google Novivac Parvovirus and ask the strength. The truth will come out. Do your research. Novivac vaccine has only 2B. And because it is central between 2A and 2C, it protects both of them. You can discuss that and I can accept it. Most of us have done a lot of research and a lot of work. Another thing I want to say, which Abiada said, is that cachexia puppies are prone to Parvo. Cachexia puppies, because when I was managing it in 1988 to maybe 1991, before I refused to practice canine medicine, and then went into what looked like a greener pasture. Most times you battle hell to be able to manage effectively. But if I am a vet now and a clinician, I'll start managing those dogs when they took in to when they get out of. But I don't know whether the narrative has changed, because during our own time, it is age dependent. That between 6 months and I don't know, because things change. And the things we are told in school is that you don't have double-stranded DNA viruses, but now we have started having, so you don't have single-stranded DNA viruses, but now all that means that all are double. But now we are having some funny things whereby we have single-stranded DNA viruses, including Parvovirus. And because it's DNA, it is easy to, it is easy to reassort, and assort to reassort, meaning that you have the positive and negative strand already there, unlike in RNA virus where it's very difficult. So mutation is easier. So we should be looking forward for a lot of things. I think Obobowale should be able to discuss most of these things. And then taking puppies to clinic. Taking puppies to clinic at the point they are vulnerable to parvo. It's not a biosecure attitude at all. Because my observation is that you can easily infect those clinics, and it's very difficult to de-infect or parvo, which I just mentioned now. So we should be mindful puppies that come to clinic and go, or you have an infection center whereby everything on your head is that you look out to disinfect that environment thoroughly using the specific disinfectant. That means infectious disease arena, or you do what Abiade said. Because if you contaminate that environment, it is every puppy that comes will be having parvo for one thing or the other. Even for rabies, we'll be having parvo. So we should have this. I don't know. I'm talking like a layman who left canine practice probably 28 years ago. But I think from my little experience, and I marketed parvo vaccine for close to 25 years. Yes. But the problem we are having is it's not about improper vaccination. It's about improper vaccines from production plant. At times you give parvo vaccine, you count the incubation period, those puppies have started having parvo already, meaning that the vaccine they were given, instead of being immunogenic, is pathogenic because of improper attenuation from some areas that have some shaky regulatory credentials. There are some areas in the world you have this. We have marketed vaccine from United States of America, and then from France. All the clinicians here have bought my vaccines, Nasir, Enahoro. Right. But I left. What made me to leave is that when those vaccines started coming, I started looking at vaccines from expiration, because they said, yeah, vaccine is vaccine, and people need to make money. They were more cheap, far more cheaper. And I don't know whether it's the import of what we're having today. But anyway, Kayode and your group start distilling out brew and distill out fantastic topics like this in future, and you can see the crowd will come.
Thank you.
But if your topics are shaky, it's only shaky people that will come. On that note,
thank you so much, Dr. Charles and Elder Stateman, one-time President, National Nigerian Veterinary Medical Association. Thank you so much. It's always a delight to have you. Let's take Dr. Matthew Ayola. Dr. Matthew Ayola, please, I would prefer we stay just straight to the point. You said you're watching from the United Kingdom. Let's get a different perspective. I'm also going to be calling, I see Dr. OK, young vets. I'm an advocate for young vets, and I want to ensure adequate representation in this meeting. All right, go ahead, Dr.
Yeah,
Matthew.
thank you very much. I'm really excited to be part of this meeting, and I want to thank and congratulate the
Right.
Hello?
Okay, so we can hear you now. We lost you a little.
All right. So, yes, I just want to contribute to all the discourse that our colleagues have been having over this topic on parvovirus, enteritis management, prevention, and the cost aspect. I can't talk about the cost aspect because it's a different country I'm operating in. Now, I just want to give a kind of ideas, to us over there, because compared to what we have here, we've got all the state of the arts in terms of diagnosis, management, and all the things. But I really, I'm really impressed with how far we have gone back home in Nigeria. But management-wise, I would like to just state that, the first thing that we should really be mindful of about pathology of or pathogenesis of parvovirus infection in dogs is that what kills them is not even the virus itself, but because of the rate of fluid and electrolyte loss, is so rapid that dogs go into metabolic acidosis, which is what kills them. So because of that, early treatment with intravenous fluid is very, very paramount. So giving them intravenous fluid is one of the key things that can determine their survival. And the intravenous fluid that is recommended is usually lactated Ringer solution or Hartmann solution. Dr. Nasir was talking about hypokalemia the other time, which is one of the hallmark of the infection. With lactated Ringers or Hartmann solution, you have enough potassium in the fluid that you will be replacing as you are giving the intravenous fluid.
Okay,
and
we need to also just summarize so that we can take other people's comments.
So intravenous fluid is very, very important. Then if you can also try and prevent vomiting by giving antiemetics. I know the medications over there may not be what we use here. If you can get something like meropetam or some other antiemetics that are available with in humans, to prevent vomiting. Then antibiotics is also very, very important. Then in terms of monitoring blood-wise, glucose is very important. If you can monitor the glucose, because they also come down with hypoglycemia, because of the rate of the fluid loss. So supplementing with glucose is also very, very important. Thank you very much. But prevention is always better and cheaper than cure, as our colleagues have mentioned. Thank you very much.
Thank you, Dr. Matthew, giving us the UK experience of the management of parvovirus. All right, so Ade Kayode, please can you, but if you will be very fast, then I can take more comments. If you are very fast, go ahead.
Thank you very much. I want to toe the line of Dr. Tunji Nasir, Dr. Abiade, Dr. Gania Hanahoru, because they have wealth of experience in parvo cases management. And that is the aspect of chemistry, blood chemistry monitoring. Blood chemistry monitoring is what most people don't do, and that is very important, especially with regards to the effect of parvovirus on the lymphoid tissues. That is, it causes depression in immune cells mobilization. So band cells, if the band cells are not available, then you know that the prognosis is poor. So those things are landmark issues that will help us to determine the prognosis. Then secondly, Dr. Moboale said so many things about treatment of parvoenteritis, but he didn't mention fecal microbiota transplantation, which is the latest thing in issue of parvovirus management and treatment. And I think people can read it up. It's an innovative aspect of treatment with regards to diarrhea, putting the fecal sample from a healthy animal in a parvoenteritis infected animal.
Really?
So
I think you can drop the name on the chat box so that people can read up on that. This is very strange. This is the first time I'm hearing that.
Yeah.
But thank you so much for
fecal microbiota transplantation. Very important.
Just type it in the chat box. Okay, that will be fine.
I'll do that. I think also say this, Dr. Kayode, is that these veterans that I've spoken today, Dr. Tunji Nasir, Dr. Abiade, Dr. Ghanaian Nahuru, will be their clinic will be a good starting point for fellowship.
Thank you so much for that comment. Let me take more. Dr. Kerr, please, can you quickly say something briefly so that I can also take other people's comments?
Hi, good afternoon, sir, and good afternoon, everybody, senior colleagues and everyone participating today. So speaking as a young vet, first, I would want to talk about the aspect of pricing for young vets, for younger vets. So I think it was Dr. Abiade who mentioned something about charging 200,000 naira for treating parvo cases, which would definitely not be practicable for a lot of us who are just coming up. Personally, I do not treat parvo cases. There's no amount of money you're going to pay me that will make me handle a parvo case. I don't treat parvo cases. Most of the time I refer, because I've had very nasty experiences where I've lost some of my dogs because I was treating somebody else's parvo case. So usually right from when I started practicing, when I started doing my own business, I'll tell clients, oh, I have so and so person that I can refer you to, and I'm very sure that they'll do a good job. So usually I partner with colleagues who are also young vets like myself that I'm sure have the time and the capacity to do what I think they should do. So if I have a client who comes to me and says, oh, my dog is sick, my dog is throwing up, which most of the time they will not give you honest responses. So a lot of clients lie. That's some of the problem that we have. Clients lie a lot. So if a customer says, my dog started vomiting this morning, for example, I'll tell you, okay, call so-and-so person, tell him where you live, he will come to you. Or if you can go to his clinic, that's fine. So I have 4 or 5 doctors in Ibadan that I do that with. So I'll tell you, call this person, they would handle your case. Initially, I used to charge referral fees from these doctors. But over time, I realized that I really do not need most of these things. So I just tell them, okay, call this person and they will handle it. And I just leave them with the doctors. They will still come back to me to buy what they need to buy. So most of the time, what some young vets fear is that when they refer their colleagues, the clients will go there. But I feel that if you do a good job on your own part, your clients are not going anywhere. So that's one of the fears that makes us not do referrals. So if you're a good vet, if you're a good business owner, your clients, and you are not afraid of your clients running away from you. So you can easily refer and still have that confidence that they will come back when they are done with their treatments. And then there's another part of prevention.
Very fast, that's 20 seconds, go ahead.
Okay, so prevention, I think, is very important, and then we have to make vaccines less available to quacks and to dog owners. So if quacks cannot access these vaccines, dog owners are not vaccinated by themselves, then we'll have less of these problems. That's what I think.
All right, thank you so much. It feels good to have a younger vet like me opinion. All right, so Professor James Olopade, just if you don't mind, quickly, straight to the point so that I can take one more person, read the comments, and then we're done for today. I can hand over to Dr. Tumsia. Professor James Olopade, he was the former dean for, if I'm right, University of Ibadan, if I'm right?
Yeah, thank you.
All right, thank you so much, Prof.
More important, I'm the director of the veterinary hospital.
Okay.
Now, and
fantastic.
So when people can't pay the 200,000 or 100,000, so what you expect most times is that many people run to the veterinary teaching hospital, which our mandate is to make sure that we teach students. And over years, we've always had to manage parvo, and then issues of biosecurity becomes a key problem for us. And in the last few years, we now have a dedicated parvo infectious unit where parvo cases are treated. We are now working on a parvo boarding unit. Okay, so that means a boarding, you have just treatment, but also boarding. And we can't charge that much because it's a nice opportunity for our students to learn and go about parvo treatment. And like Professor Mobale has said, we've found the research about bleach, about its effectiveness. So we always make sure we disinfect after our parvo case. But the last point I will leave, which I think is to look at in the future, is we have 3 variants over 40 years. In as much as we are so used to COVID and variation, 3 variants in 40 years is a lot. And for a country like ours with MVRI, we need to start looking at that future of producing our own parvo vaccines as a country, based on the constant surveillance of the variations that are existing in Nigeria. That is how to get a complete hold on prevention of parvovirus. Unless all our efforts will still be geared towards treatment rather than having a hold on prevention, since we are importing the vaccine from different places. We did not take our own specific sequences in our country into consideration when they were making their vaccines. Thank you very much.
This is brilliant, Prof. And then thank you for the good work you do for us at the Teaching Hospital, University of Ibadan. So the last person, Dr. Joseph Inedu, briefly, and then we'll move on to the next thing so I can hand over back to Dr. Tumsia. Dr. Joseph Inedu, briefly.
Okay, good afternoon, everyone. Hello, can you hear me?
Yes, we can hear you. Go ahead.
Okay, good afternoon, everyone. John Transit. Yeah, my take is about prevention. Yeah, I usually advocate to my clients that once a bitch takes in, we are certain that the bitch is pregnant. The pentavalent vaccine should be administered so that the puppies would have maternal immunity before they were giving birth. When they're giving birth, they'll be able to stand whatever rigors before the period of their vaccine at the 6 months. That is charging 100,000. I think that's 100,000. I think that's based on location, because quacks are in the field, and some of them can just, once they know you are expensive, they just flip their way to the quacks, and you just be left hovering around your clinic without any work, especially when it comes to diagnosis and treatment of parvovirus enteritis. And this is also a challenge, just as the previous speakers said, a challenge to MVRI that we should create a model of our own vaccine so that it will be to take care of our situations around Nigeria. This is all I have to say. Thanks.
Thank you so much, Dr. Joseph. Comments we have on the chat, some of them have been handled, some of them require some extensive talk. Before, when we're doing the pre-test for this echo, we had a discussion around doing the part 2. We have all the comments. My team and I will sit down with Dr. Tumsia leading this to figure out how we can bring up another discussion from this discussion so that we can have a robust view of what's happening. I'm just going to give Professor Mobowale 30 seconds to say something as a way of, to have all the experts, just one thing you pick from this conversation, and then so that we can hand over to Dr. Tumsia, who will eventually end this meeting for us. So Professor Mobowale, followed by Dr. Tunji Nasir, then Dr. Abiade, then finally Dr. Gani. 30 seconds each. Thank you very much.
Thank you very much. My 30 seconds commences in 1 minute. Sincerely, if we as clinicians follow all the recommendations in this in the discussions we've had today, we are going to be having very good success rates, and we are not going to be taking upon ourselves another man's iniquity. What do I mean by that? Somebody presents a bad case to you very late and you don't do your investigations very well before you take up the animal. The animal dies the next day and you take all the blame. We know how our clients do. I have two very brief comments concerning the issue of the CPV 2C protecting against 2B protecting against 2A and 2C. As researchers and clinicians, we don't rely on information just from vaccine manufacturers. I can tell you, even from papers that were published this year, early this year, there is still a lot of controversy about the cross protection. So as a researcher and a clinician, I cannot recommend what I have not personally done. So that is it. We need to be careful. Then secondly, concerning the issue of fecal microbiota, is still in the research phase. There is a lot of inconsistent results. If anything is found useful in that, I believe World Small Animal Veterinary Association is going to look into it and recommend it as a treatment modality. There are so many things we also discover, like there is oxidative stress, very, very serious in Parvovirus, but we have yet to conclude that treatment of oxidative stress in Parvo positively affects clinical outcome. So I cannot be bringing that to this kind of forum. This is purely clinical, not research. Thank you.
Thank you so much, Professor Mobowale. Brilliant summary. Let's take Dr. Tunji Nasir quickly, 30 seconds, and let's have this going so that I can hand over to Dr. Tumsia. Dr. Tunji Nasir.
Yes, I think it has been a very well organized program this afternoon. But like I said, what I want to really emphasize is, yes, it is preventable. And I think most of our strategies should be geared towards preventing Parvo from happening at all. And I want to encourage the organizers of this program to let us look at vaccination, vaccines and vaccinations. Because there are lots that we could have discussed about Parvovirus this afternoon, preventing Parvovirus this afternoon, that we have not even thought. We didn't even scratch them at all. So I think we're just mentioning management. Well, that will even prevent, because now it is not a single one that you have to give 3 puppy series. Sometimes, depending on when you start, from 6 weeks, and then the frequency of the interval, you also choose to give your vaccines. You can even give up to 4 or 5, before they are 20 weeks. So there are lots of scenarios that we have not played out this afternoon. But I would say it is important that when we want to vaccinate our puppies, is that puppy clinically competent to take that vaccine? Because we don't ask ourselves all those things. If the puppies are not clinically competent, so it is important that you do your physical examination very, very well. Take your history, do your physical examination, determine whether that puppy is clinically competent to take that vaccine from you. Otherwise, you'll be causing the problem. Like I said, I want to enjoin the organizers that we have not scratched this topic at all. And you know what that means.
I'm beginning to strongly consider we might do a part 2 just focusing on the vaccines, because I see a lot of some of these importers comment on the chat board also arguing that their vaccines does what we are saying they didn't do. So we will consider that very strongly. Dr. Kunle Abiade, 30 seconds. Dr. Kunle Abiade, 30 seconds. If we don't...
I just want to respond to Dr. Inedu. You know, many of us, we are designing our own vaccine vaccination protocols, and I think that's what we need to have a part two. He is saying that he is vaccinating pregnant. It is not advisable, because by the time the puppies have the antibody titer will be very, very high. If you're going to do that, that means you are going to delay the vaccination of those puppies. So what is not recommended, please, let's not start doing it. This vaccination of 4 weeks, 6 weeks is not recommended. But people are not designing their own, breeders are designing their own, and that is why we are having this problem. Okay, Dr. You said at the 6th, you stop all medication. Please, next time, don't stop all medications. Okay, I mean, still continue, except for the intravenous, because you didn't tell us the other supplemental, you know, please don't just say because it has stopped. One of the things with Parvo is that it will cause gastritis. And that is, if it's still there. So you don't just stop the drugs abruptly. Please just continue with it until you're able to narrow it down to a very safe. Even after it has, just continue with it. If it's not on antibiotics, continue antibiotics for about 10 days, you know, and get yourself on the very safe medication. I pray that we have a second, because as Tunji said, we have so much to say. We have so much about vaccine. We have so much about prevention. But it's been a wonderful program. It's been and I hope that some of us are taking some points home. God bless you. Thank you, Farmalert. You know, you are doing a great job. God bless you.
Thank you so much. That was very thoughtful. Now let's take Dr. Gani and Ahoro finally.
Yeah, thank you, Femi. I think I was prophetic when I was saying that we must have a patrol.
Yes, you said so.
Let me, just to make a response to one or two things I saw on the chat box, a lot of people talking about Parvo cases, the dogs will not eat, and then therefore there's no need for us to feed. No, that's not correct. The dogs or the puppies don't have to want to eat. That's why Tunji talked about the nasopharyngeal tubing. And if you can't do that, there is what we call modified force feeding. You just have to encourage the patency of GIT. It's very important. And you should go and find out, we should all go and find out how intussusception takes place. You know, when you allow the anti-peristaltic and the peristaltic movements to control themselves. So we need to find a way to feed the dogs, even when they look like they don't want to eat. 2, the biodata management experimentation, which Prof just said now, is still under research, which Inedu, I think was Inedu, was suggesting that it's been very helpful. Even now, in managing Parvo, I have done a lot of probiotics to help to improve the flora, the intestinal flora, because part of the losses through the hemorrhagic diarrhea is that the environment is almost completely destroyed, and you have to build up again the microflora in the GIT. So we can still go with the use of probiotics copiously when we are having to manage Parvovirus. That's been very useful for me, and I also recommend it to all our colleagues to keep it in mind. Thank you.
Thank you so much to all our hub experts. Time will fail me to thank us most heartily. We are going to bring back this same set of hub experts back for the part 2 after discussing with the team. Dr. Tumsia, I need to really apologize for overshooting my time, but I believe the discussion was worth it. So over to you, Dr. Tumsia.
Okay, thank you so much. This has really been an interesting session. And I wouldn't say, I think I'm, at this point, I think I'm oversaturated. I need to sit down and be able to cool myself down. My brain is literally on fire. I learned a lot of things, and I'm sure everybody on this platform did the same. And from what with all that has been said, our experts here have advised us to invest in diagnosis, invest in biosecurity, and also learn to refer when you know you don't have the facility to manage parvoviral enteritis. For me, these are very important points we need to hold very close. And after this, it went way beyond the time allotted for this discussion, but it was so interesting. I didn't even realize time had gone past so fast. So we're going to take a post quiz. We had a pre-quiz before the presentation. So we're going to have a post quiz. It's just to measure knowledge gain, nothing else. So please, can I have the poll on the screen? I implore everyone to please partake and just answer the questions. There are just 5 questions. So the poll is coming up on the screen. And please, so we're going to have 3 minutes. We had about, I think about 69% participation from the pre-quiz, hoping to get more from the post-quiz. Can I have the poll up? And after that, it's just going to be announcement and we can call it a day. This has been interesting. Parvovirus is a breeder's nightmare. It's a veterinarian's nightmare. It's a dog owner's nightmare. So we need to come together and standardize practice. So we have the poll up. Okay, just 5 questions, 3 minutes. You have the poll on your screen. Yes, 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 yes. We're coming up. Please do answer. Yes, this is interesting. Woo, it's coming up well. It's coming up well. Okay, yes, we have 35% in less than a minute. This is impressive. 45%, this is good. So as I said, this is answered based on anonymity. It's not showing anybody's name. Nobody's going to come after anybody. Nobody's going to receive any cause or receive anything that has to do with parvoviral enteritis.
Or receipt.
Yes, or yes. So it's just for us to measure knowledge gained at the end of the presentation to make sure that we're getting enough, we're getting valuable information to go and improve our practices and be better clinicians. Yeah, we have about 1 hour, 30 minutes gone. It's just for 3 minutes. We have 61% participation, which is good. I want us to beat the participation for the pre-quiz, which was around 69%. We're at 64%, about 2 minutes gone. Just 5 questions. Yep. It's coming on well. We can do better. I have just 91 out of 141. We can do better. We still have about a minute to go. This is really interesting. I would have sworn this was just for 30 minutes. Just looking at it now, I've realized we spent over 2 hours, but because it's interesting, I didn't see time passing. Okay, we have 67%. We can do better. We can do better. 95 people out of 139. Yeah, this is coming well. 2 minutes, 35 seconds. I'm going to do a countdown soon, and then the quiz is up, and then we'll just take the questions quickly and get our answer from the hub expert, Professor Tayo Omobowale. Yay, we have 71%. So my countdown: 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And that's it. We can end the poll now. We had 72% response, which is impressive. So we can end the poll now. Thank you. Yeah, so we're going to take the questions one after the other, one at a time. So Dr. Tayo Omobowale,
Yeah, thank you very much.
Yes, you're welcome,
I should
sir.
give
Thank you too.
the answers.
No, I'm going to read out the questions. Please, I need the questions for the results for the post quiz, not the pre-quiz. Okay, so the first question is the canine parvovirus can also infect cats. True or false?
True.
Sir, can you hear me?
True.
Yeah,
oh, that's impressive. We have about
69%. Anyway.
69% of the people, of the participants actually said true. Second question. Second question, please.
Second question. There are three.
Okay.
There are three.
There are three variants of the virus, all of which have been detected in Nigeria. True or false?
True.
That's impressive. We had about 89% say true. Third question, vaccination with DHLPP vaccine should commence at the age of 2 weeks. True or false?
False.
Impressive, about 94%. Hypochlorite, common bleach, is a highly effective disinfectant that destroys the parvovirus enteritis. True or false?
True.
This is big. We had 99% say true and just 1% say false. And the last question, the virus is easily destroyed in the environment. True or false? Thank you so much, sir. We have 97% agree with you, which is the right answer, false. Thank you so much, sir. And so as I said, so this is just going to help us measure. We're going to compare the pre-quiz and the post-quiz and say, okay, before the presentation and after the presentation. Thank you so much. It has been an insightful and informative session for me, and I'm sure for everybody else on board. As I said, parvovirus enteritis is a veterinarian's nightmare, a breeder's nightmare, and a dog owner's nightmare. So we need to find a way to prevent. We have to keep hammering on prevention. We have to keep hammering on prevention and proper management. So I would love you to drop comments about suggestions for the next topic, what you would like us to come on board with and discuss in the teleeducation series. We have about 2 minutes. We have somebody extracting your suggestions. So please suggest topics you want us to come on board and discuss. Bring on board experts so we can have their recommendation, and at the end of the day be able to standardize our practice. So keep your comments coming, your suggestions for our topics for the next presentation. The next session. Yes. So what topics would you want us to address? Keep the comments coming. I guess during the presentation, a lot of comments kept coming in. I can see ASF, so we're going to consider, yes, even during the last session, somebody else suggested African swine fever vaccine and vaccination in small animal practice. Somebody suggested flu therapy, which is also good. So keep it coming. And okay, thank you all so much for your suggestions. Our upcoming event, we're excited to announce that the next teleeducation series will be African Continental Free Trade Area, Impact on Africa's Animal Health. We're having participating countries, Nigeria, Ghana, Tanzania, Uganda, Kenya, South Africa, on the 5th of May, 2022. So we'll be seeing you on the 5th of May. We're going to buzz you with a lot of information about the next session. So thank you so much once again for coming on board. God bless you all, and have a nice day. Thank you. And don't forget to follow us on all our social media handles. You can just simply type Farmalert. Is it on YouTube, LinkedIn, Instagram, Facebook? We're all present. Twitter, you name it all. Yes, please do follow us on all our social media handles. Thank you. All right, have a nice day. Stay blessed. Bye.
Thank you. Thank you.
Thank you, sir.
Thank you, but please try to attend to questions on the platform. None of them was addressed. Thank you.
Femi, wonderful outing. You are going places. Sincere. You and Femi, who again is in your squad? You were taking us to the moon.
Good afternoon, sir.
Sincere, my sister.
Yes,
sir. You were taking us to the moon.
That's the dream, sir. That's the plan.
We're almost landing there. And then my friend who took over from me from Speak Out, has changed the narrative. Has changed the narrative automatically, right? Right under my nose, the narrative slipped me. That's the rug was pulled. I didn't even know where it was pulled. Whether he hypnotized me, I didn't know. Professor Mobowale, you are still your true selves. Gathering all those diseases. Gathering. And still play your piano.
Thank you, sir.
So we thank God. Yeah.
Thank you, sir.
You know, when intellect meet.
Oh, Prof. Thank you so much.
Yes, sir.
You are welcome, ma.
Thank you too. Thank you, ma.
Yeah. Cohesion of intellect from research, from clinic, from everywhere is well. I think the more these diseases come in, the more we eat. So